Good evening, everyone. Firstly, I'd like to acknowledge the traditional owners, the Wanneroo people, as the traditional owners of this land where this historic historic event is taking place. I'd like to also acknowledge that the land, rivers and mountains have always been under their continual custodianship. So as Chris said, my name's Karl Briscoe. I'm the CEO of the National Aboriginal and Torres Strait Islander Health Work Association. We're based in Canberra, and it's actually a great privilege and honour for NATSIHWA to be the sponsor of this event this evening and to be involved in celebrating AIDA's 20th anniversary. What an achievement. I would also like to thank Karl and the board, along with Craig Jukes and his staff, for putting on this, arranging the arrangements for this event this evening. We at NATSIHWA, we recognise that our profession is one of many entry pathways for Aboriginal and Torres Strait Islander people into the health sector. The close partnership approaches that exist with AIDA enables the strengthening of such pathways whilst ensuring our Aboriginal and Torres Strait Islander workforces are supported both culturally and professionally to enable the best possible outcomes for our people. Some of the shared important pieces of work that we undertake with AIDA and other partners, the Allied Health and Association and CATSINAM, the Congress of Aboriginal and Torres Strait Islander Nurses and Midwives, is the next iteration of the National Aboriginal and Torres Strait Islander Health Implementation Plan, specifically around the cultural and social determinants of health. The National Health Leadership Forum, which brings together senior Aboriginal and Torres Strait Islander health leaders of peak organisations to consult on health policies for Australia's First People. We also work with the National Congress of Australia's First People, specifically the Redfern Statement, which is a coordinated effort in calling for urgent action by the government to making Close the Gap as an agreed national priority, with all Aboriginal and Torres Strait Islander peak health organisations informing the process. We also look at the National Close the Gap campaign to make it happen for our people, which is co-chaired by June Oscar, the Aboriginal and Torres Strait Islander Social Justice Commissioner, and Rod Little, the co-chair of National Congress. One of the big joint presentations that we undertook earlier this year with the 4 CEOs was at the National Rural Health Alliance Conference, where we showcased cultural safety and cultural responsiveness. So it was a shared presentation and really, really well received. Other joint advocacy work which we undertake with AIDA includes ministerial health forums and meetings in a coordinated effort, to support our members throughout Australia. I suppose in closing, I just want to say on behalf of NATSIHWA, congratulations to AIDA for reaching this major milestone, and we look forward to working closely with you over the next 20 years. Congratulations.